Healthcare debates in Congress can sometimes sound technical, but this hearing featuring Representative Diana DeGette gets at a question millions of families face every day. When someone is living with diabetes, heart disease, cancer, or multiple chronic illnesses, who is actually helping manage everything? That is the issue at the center of this conversation.
And recognize the ranking member, Diana DeGette, for her 5 minutes.
Thank you so much, Mr. Chairman. Dr. Furr, I was really struck by your testimony, and it reminded me of my childhood doctor, Dr. Ritalik, who would do all the things that you talked about, and how in this day and age we have so few doctors like you. So thank you so much for what you do. In your testimony, you mentioned only 3.4% of Medicare goes to primary care, which is the lowest across all payers. But meanwhile, over 9 in 10 American adults 60 and older have at least one chronic condition, and nearly 80% have 2 or more. So I guess I'm wondering if you can talk for a moment a little bit more about the role of primary care doctors in managing chronic conditions.
I see the primary care physician as the quarterback of the team. We got very talented players all across the team, but if you don't have a quarterback calling the plays, the care is not going to be what it should be. So we spend a tremendous amount of time coordinating care where they're seeing the oncologist, the neurologist, their cardiologist. They come back to us. They just got out of the hospital. They don't know what medicines they're supposed to be taking. We spend hours sometimes going through that, calling different places to see what medicines they're supposed to be on. So somebody's got to coordinate that care. And just like when a patient comes in, like I said, they've been in the hospital, their blood sugars are out of control, somebody's got to work with them and maintain that. And that's part of the chronic care along with that, is we have our nurses calling them every month, checking on them, see what their needs are. Have they seen another specialist? Have the medicines changed? Is there anything they need to maintain their care?
And it has a much better patient outcome, doesn't it?
Yes, much better patient outcome. In fact, when you look at the numbers on chronic care management, for that low-cost service, Medicare saves $95 a month for every patient who's in chronic care management versus the Medicare patient who's not.
And this is not the kind of thing you can do just in a 10-minute or 15-minute increment. It takes time to do this kind of care. Is that right?
It takes time. It takes a whole team. It's our nurses, it's our front staff, our chronic care management, our nurse practitioners, all of us working together.
Yeah, I saw a study that estimated the average primary care doctor, given a typical patient load, would need nearly 27 hours a day to deliver guideline-recommended care. So maybe when we do the daylight savings time, we can expand the number of hours for primary care physicians. Obviously, seriously, Dr. Fox, I want to ask you, what does Medicare really pay for? Is it for patient care over time, or is it for something else?
Yeah, great question. The Medicare physician fee schedule is really designed to pay for episodic care. A doctor delivers a discrete service and then submits a bill.
Right.
What Medicare is not good at is paying to care for patients with chronic, complex illnesses longitudinally over time of the type that Dr. Furr referenced.
Yeah.
More recently, there are some codes out of Medicare, the APCM codes and the G2211 codes, which are beginning to recognize this longitudinal care, and we should support and strengthen those.
We should strengthen it, yeah, because we're asking more from primary care doctors, but we're not compensating them. And frankly, this doesn't incentivize the type of care that keeps people healthy in their homes and out of the hospital. So I want to ask Dr. Fox, is the low payment that we're seeing right now the main driver of new doctors not going into primary care, do you think?
Yes, absolutely, in part, and studies show this. Studies show that the choice of specialty is influenced by the income potential of the field. And we know this, and it's published in the literature. There are other things. There is a lack of perceived prestige in primary care. And there is a disproportionate amount of administrative burden which falls on primary care, and those things play a role as well. But certainly the income plays a role, and as I believe you mentioned, the millions of dollars of income that is given up when one chooses a career in primary care.
Right. So, Mr. Chairman, I think this is really something this subcommittee can work on in a bipartisan way, because I think it's recognized by everybody, and it is a growing national crisis. I yield back.
DeGette highlights a reality many Americans already feel: primary care doctors are stretched thin while chronic illness is rising, especially among seniors. Nearly 9 in 10 Americans over 60 live with at least one chronic condition, yet only a small portion of Medicare spending goes toward primary care. To explain why that matters, Dr. Furr compares a primary care doctor to the quarterback of a healthcare team. Think about what happens after someone leaves the hospital. That distinction matters. A doctor may spend significant time coordinating care, preventing complications, and helping patients stay healthy at home, but historically that work has not been compensated the same way as shorter billable services. From a democratic perspective, This raises both a healthcare and fairness issue. If primary care is undervalued, fewer doctors may choose it as a profession. And that concern comes up directly in the hearing. When DeGette asks whether low payment discourages doctors from entering primary care, Dr. Fox answers plainly, yes. The result is something many Americans already experience: longer waits, rushed appointments, fewer family doctors, and more seniors struggling to navigate complicated healthcare systems alone. What stands out in this hearing is the idea that this could be an issue lawmakers from both parties work on together. Because eventually, almost every family faces the same question. Should healthcare reward keeping people healthy, or mostly pay once people become sick enough to end up back in the hospital? What do you think? Should Medicare invest more in primary care and chronic disease management? Let us know in the comments and subscribe for more breakdowns of what congressional hearings mean for everyday Americans.